Triad physicians are warning about COVID in summer camps and other activities. Now, the data shows case counts aren't nearly what they were 2 years ago, the height of the pandemic, but doctors say they're seeing an increase in people coming in to get tested.
It's always good to be careful and know the best, most current advice. That is why WFMY News 2's Hunter Funk breaks down what they're seeing and what you need to know.
Yeah, good morning, you guys. It's summertime, so there's the social gatherings of seeing friends and family, going overseas. Maybe those kids are going to summer camps and enjoying those activities, which calls for larger social gatherings. It's because of this that Novant Health doctors believe they're seeing an uptick in these cases. Now, Northern Medicine Medical Director and Physician Chan Badger says he's seen more people coming into his office to get tested. Badger says the severity in cases are not as extreme, which is a positive sign. However, he says it's still important to take the right steps to keep everyone safe, especially those who have a weakened immune system. Common signs that you should get tested are fever, body aches, congestion, coughing, and fatigue. Loss of taste and smell, though, is not as common of a symptom anymore, so let that be noted. He said it can be confusing because it's similar to the common cold, but you should still be getting tested if you have any of these symptoms.
The severity of the symptoms and such tend to be a little bit less than what they were at the beginning, and people are less fearful of it. And so, a lot of people are saying, oh, it's just allergies, or it's the common cold, or it's a sinus infection. I hear all of those things all the time here in the clinic. And, maybe people don't want to admit that they have COVID or don't want to test for COVID because they know what that means, and the masking and the quarantining and all that for their social responsibility. So I feel like people are sort of downplaying the potential for it to be COVID and therefore not testing enough and then exposing others as a result of it.
And if you do feel a bit under the weather and you do test positive for COVID, remember the steps, right? 5 days of quarantine and then 5 more days of wearing a mask out in public.